Asking the research question. The process of evidence-based practice starts by asking a relevant clinical question. The question provides a direction for decision-making related to a patient's diagnosis, prognosis, or intervention. Questions may also relate to etiology of the patient's problem, the validity of clinical guidelines, safety, or cost-effectiveness of care. It should not be surprising that the ability to formulate a good question is essential to finding a relevant answer. It is not a general question, but one that focuses specifically on the characteristics of the patient and issues related to his or her management. The acronym PICO has been used to represent the components of a good clinical question: patients, intervention, comparison, and outcome. P. What is the target population? What are the characteristics of the patient or problem that should be considered? I. What is the intervention that is being considered? This component may also be prognostic factor or diagnostic test. In the case of a diagnostic test, the acronym would be PICO, P-E-C-O, E representing examination. C. What comparison or control condition is being considered? This component is most appropriate when comparing the effectiveness of two interventions or when comparing the accuracy of two or more diagnostic tests. It will not be relevant for a question of prognosis or when examining only one intervention or diagnostic test. O. What are the outcomes of interest? What measures will be relevant to understanding the effectiveness of an intervention, the importance of a prognostic factor, or the accuracy of a diagnostic test? A PICO is a unique, searchable, answerable question that a clinician or researcher constructs as a result of a review of the literature. One cannot construct a PICO question without first looking at the literature, without risk of asking a question that is not searchable, meaning there is insufficient literature to answer the question. Likewise, if the question has been clearly answered already, what is the point of asking it? With regard to answering the question, the clinician or researcher should use the highest levels of evidence available. Meta-analysis, systematic reviews, and randomized control trials are ideal, whereas case studies and narrative reviews are not. Whenever you gather a body of literature, it is helpful to construct a table and populate it with the pertinent details of each study. You can then use the table to synthesize or summarize your findings. This slide represents the component parts of a PICO: a statement of the problem, the PICO acronym in question, and the answer. The statement of the problem speaks to the problem, provides pertinent demographic details, and makes a case for why we care. The answer summarizes the quality of the available literature, makes a case for the answer, including conflicts within the literature, and provides implications for clinicians and future research. The research process begins when a researcher identifies a specific topic of interest. Once a topic is identified, the process of clarifying a research problem begins by sorting through ideas, facts, and theories based on clinical experience and professional literature to determine what we know, what we don't know, and what we need to find out. The application of this information will lead to identification of a research problem that will provide the foundation for delineating a specific research question that can be answered within a single study. Research problems often emerge from some aspect of practice that presents a dilemma. Clinicians will often examine the theories that govern their practice as a source of research questions. Professional literature provides the basis for developing a research question in several ways. First, it will clarify holes in professional knowledge, areas where we do not have sufficient information for making clinical decisions. Another source of ideas derives from conflicts in the literature, when studies present contradictory findings. Professional literature may also identify disagreements due to differences or flaws in study design or measurement methods. Research questions can also arise from descriptive studies. When developing a research study, there is much thought and consideration made in the planning. The question should be important. The question should be answerable. The study should be feasible. What is the target population? What are the variables? Independent and dependent? What are the outcome measures? This weekend lecture, you will talk about specific aims, hypothesis testing, and study purpose. You can choose your groups for your PICO project. Please formulate them prior to class and send your professor an email with group members. In addition to discussing specific aims, hypothesis testing, and study purpose, the PICO assignment will be introduced. You will have time to begin your search and begin to formulate your question.